health care. I proposed the American Health Choices Plan, and it's real simple. If you have health care that you're happy with, nothing changes. But if you're uninsured, or you have insurance, but it's the kind of insurance I hear about all the time here in Iowa, from people who come up to me and say, you know, I have insurance, but I'm a diabetic and it won't cover my diabetes. Or I had cancer and it won't cover it if it comes back. So if you have that kind of insurance, you need additional options. I want to ask you, how many of you know somebody who's uninsured? And how many of you, maybe you yourself, know someone who has insurance, you paid your premiums, except when the doctor and the hospital want to get paid for what they say you need done, the insurance company says no. Wow. You see, we've got two problems. We talk a lot about the uninsured, but we have the problem of the underinsured. Millions more of people who think they're doing the right thing by having their insurance. So here's what will be available to all of you. We're going to open up the Congressional Health Plan. Congress has a very good health plan for itself, its staff, and federal employees. It has more than 250 options, and these are good plans. They cover mental health, something that every health insurance plan in America should cover. Let's end the differentiation and the stigma about mental health. On average, they are less costly than what you can get through your employer or what you can buy in the private marketplace. And of course, one of the reasons they are less costly is because you, the taxpayers, pay 75% of it. So the next time you see your congressman, ask him how he likes the health care you're paying for. Because I think if it's good enough for Congress, it should be good enough for any American, and we're going to make sure that it is available to you. And if it's still expensive, we're going to give you health care tax credits. We're going to limit the amount of money that anybody has to pay for health care premiums to a small percentage of your income, because I want everybody covered. Because we never know what's going to happen tomorrow, do we? You and I bet every one of us have known somebody who was healthy one day and next day finds out that they're suffering from some terrible illness. Or somebody leaves the house to run to the store and is in a horrible car accident. When I was making this plan and preparing it, some people said to me, you know, it's kind of controversial to try to cover everybody. You know what the Republicans will say, what they always say when you try to help people, that there's something wrong with that. And it's politically ambitious. So leave some people out, because that'll make it easier to explain and sell. I said, okay, well then who do I leave out? And who gets to choose who's left out? Do I leave out the nurse I met from Waterloo who has breast cancer? And her treatments were so debilitating that she couldn't work. And when she finally felt well enough to go back to work, the hospital said, you don't have a job anymore. She lost her job and she lost her health care. Or maybe I should decide to leave out people who are healthy today. Let's just roll the dice. You know, like the young couple I met from Webster City who own and operate an auto body shop. They're working as hard as they can to, you know, make a better life for themselves and their kids. They can't afford health insurance. Let's just hope and pray that none of their kids get hurt playing sports or riding their bikes, or there's no car accidents or illness. I am not running for president to put Band-Aids on our problems. I'm running for president to solve them. And together we're going to solve this health care issue. We're going to provide strongly affordable health care in a cost-effective way